Hi, this is Dave Boyland from Goldwyn and Boyland Physical Therapy, and I'm here with Tim Bennett from the Cortland Voice, and we're here at McGraw High School here. As you can tell, things are kind of different these days with the pandemic that we're dealing with, but here at the high school, there's still things happening, and what I wanted to do today was I wanted to offer a little language art lesson. So if you can remember back when you were in school, you learned about things like homonyms, synonyms, antonyms. Well, what's a homonym? All right, well, that's a word that sounds like another word but has a different meaning. So, for example, I could say, oh, watch out, dear, there's a deer. All right, sound the same, two different definitions. All right, I could say synonym. Well, that's two different words that aren't the same thing, but they mean the same thing. So I could say shut the door, I could say close the door. You would know what I mean. Two different words, same thing. Well, today, I just wanted to talk about a term called retronym, and that's a relatively new term in our English language. But what a retronym is a word that at one point in our time didn't need a qualifier. If you said the word, everybody knew what it meant. So for example, if you said when I was a kid, answer the phone, I would know that, well, I need to leave my chair and I need to go in the other room and I need to pick up this device that was hanging on the wall if I was going to answer the phone. Well, today phone is a retronym because it could be a cell phone, could be a smartphone, could be a flip phone, could be a landline, could be a portable phone. I'd need to know what I was talking about. Well, believe it or not, the term virus has become a retronym. And so when we were younger, a virus meant one thing. It meant a germ, something that would give you a cold or the flu, and you possibly would get sick. Average high school student, what's a virus? They'd say, well, are you talking about a computer virus? Are you talking about a virus that affects humans? Not sure what you're talking about, so you'd have to be clear. So, for example, if your computer got a virus, you would take your computer to this technician to have it fixed, and you'd say, my computer isn't working right. Well, the reality is, your computer is working right. It's just getting wrong information. It's just getting wrong data. And so this virus in my computer is causing my computer to give me information that I don't want or not get the information that I do want. But my computer isn't doing anything wrong. The virus, the input side of it, is creating the output side. Well, believe it or not, our bodies, our nervous system work a lot the same way. And so people will come in and they'll say, oh my gosh, one day my back just started hurting. There's something wrong with my back. Or, wow, my shoulder's really bothering me. I'm not really doing anything different than I would normally do. Or even someone who, let's say, has a concussion will come in and say, wow, I'm having all these symptoms now that I wasn't having before I got the concussion. So they would think that the problem is in their head. They would think that the problem is in their shoulder. They think that the problem is in their back. But the reality is, the input side of the nervous system is getting some wrong information, and that's affecting the output side. So my muscles in my back might actually be doing the right thing based on wrong information. The muscles in my shoulders think that they're doing the correct thing, but they're actually getting wrong information from the input side. And so lots of times we see these problems in problem-based healthcare, problem-based medicine as the real issue, but they're not the real issue. The real issue is further down the line or deeper into the nervous system or deeper into the system in general. And so I'm just going to give you a quick example of a patient that I saw late last spring, early last summer, who came into me with 3 distinctly different problems. So she was 86 years old, and she says, I have back pain, my balance is getting worse, and I have chronic diarrhea. And so in problem-based medicine, problem-based healthcare, she would be directed to see 3 different doctors. So she would see a spine doctor for her back, she would see a neurologist for her balance issue, and she would see a gastroenterologist for her diarrhea. Well, as it was, she saw different doctors and nobody was seeming to be able to help her. Her diarrhea was continuing, and this was going on for a long time. Her back was getting worse, her balance seemed to be getting worse. Yes, she's 86 years old, and that's a nice out for people to use, but the reality is she doesn't deserve to be experiencing these things because there's a solution. And so when she talked to me, she said very clearly to me, well, I'm having this back pain and I'm afraid that if I keep having this back pain, I'm going to have to limit my activities more and more and more. And if this balance problem gets worse, well, I'm afraid I may fall or injure myself worse. And well, with this diarrhea problem, I'm afraid that, well, I don't want to leave the house. I don't want to go very far because I don't want to have an issue. And so the reality was she had 3 different problems, but the solution to her problem, solution-based healthcare, or what we call hope set in motion, was that the fear of these 3 problems was aggravating the issue, creating the problem, and not allowing her body to resolve it. So the virus was fear, even though she had 3 distinctly different problems. Hi, this is Dave Boyland again from McGraw High School, and this is part 2 of our edition this morning about retronyms and how viruses affect our body. And so just to kind of recap the story, talking about an 86-year-old patient who was struggling with diarrhea, back pain, and a balance issue. And so what we were able to determine is that the virus was really a fear factor inside of her that was complicating these issues. So we were able to use some exercise interventions that targeted her brainstem, which is actually part of our nervous system, which triggers a lot of our fear reactions or fight or flight. And so shortly after starting this program with her, she was able to, within a couple of weeks, notice a change in her diarrhea. She was able to go out from her house more, and she was able to realize that the problem was improving. A couple weeks later, she started to recognize that her back pain was improving. And so now she was able to go further out from the house. She was able to take longer trips. She was able to start walking more, doing other things. So we actually didn't even really end up working with her balance, because just getting out allowed her and her body to reset itself, remove the virus of fear. And so by the time we were done, after a few weeks, she was able to walk 2 or 3 miles without back pain or balance issues. She was able to start playing tennis again with some younger girls in her neighborhood, and she was thrilled. So what was a situation where it looked like things were going to be getting worse and worse and worse, now she was getting better and better and better. And so these are the kinds of things that we love to discuss with patients. So please check us out on Facebook, Goldwyn and Boyland PT, or on our website, Goldwyn and Boyland PT. And we look forward to sharing more information with you in the future.